Hi everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, today's topic, we're going to talk about how to prevent miscarriage. Well, the miscarriage type is different. But by saying prevention of miscarriage, I want to make it clear to everyone, not all miscarriages can be prevented. Okay, first thing. However, you can take steps to help maintain a healthy pregnancy. So here are the few recommendations, right? The few recommendations I'm going to talk about, and I think everyone will know it. If you go to Google, you Google it, and a lot of people tell you all this similar thing, okay, similar thing. But I have some say about that, okay. Then apart from that, I'm going to show you what you can do moxibustion at home. Moxibustion, right? So moxibustion is another way to prevent miscarriage. Now, it doesn't matter what type or what was the reason of the miscarriage. As soon as you have the 4 symptoms of early sign of miscarriage, then therefore you can apply moxibustion. And in the end, I'm going to show you way to apply it. Okay. So the first thing in general, you get a regular prenatal care throughout your pregnancy, right? And avoid alcohol. So no alcohol, definitely not alcohol. Okay. And drunks and smoking while pregnant, right? So no drunks, no smoking while pregnancy, right? So I know that I always ask a question in here that people get what do you call it? A common cold. When they're pregnant, when they get cold, they just leave it. They won't do anything for it because they want to. Most people know that you don't want to take drug because you don't know what the drugs could harm to the baby. But the funny thing in here, if you're not pregnant, then you are quite okay to take antibiotics. So why is that? Why is that? But if you're pregnant, if you get a cold, if you suffer from a common cold, a flu, you won't take anything for it. But hey, to be honest, I personally don't take anything for cold, and we use Chinese herbs. But here's an option. If you get a cold, acupuncture is the best way without side effect. The only side effect is you may feel some pain from needles. That's it. So no drugs for pregnancy. If you suffer from a cold or flu while you're pregnant, acupuncture is another way you can go, right? Compared with drugs, right? So you want to avoid it. Now, the next thing is maintain a healthy weight before and during pregnancy. Okay, to maintain watch what you eat is important. Watch what you eat is important. Okay, and avoid infection. Yes, infection is one of the cause of pregnancy, miscarriage, right? So wash your hands carefully, and whenever you do things, wash your hands, right? So don't be messy. And stay away from people who are already sick. If you heard anything, if you go for gathering and you heard anyone that says a flu or cold, just stay away from them. I'm not meaning that you can't go to party, family gathering, friend gathering, coffee shop or things like that. No, you still can go, but if you see someone coughing, sniffing, just be sure that they, for the sniffing one, they're not hay fever. If they're not hay fever, stay away from them. But even in a hay fever, they might be catching a cold as well. So stay away from them. All right. Okay. So limit the amount of caffeine to no more than 200 milligrams per day. I disagree with that. The reason I say I disagree with that is I say you should not take any caffeine at all. Okay. Because caffeine and alcohol is two things that when it comes to pregnancy or infertility treatment, we try to avoid them completely. Okay. Right. Eat a healthy, well-balanced diet with lots of fruit and vegetable. You see, in if you go for a website, they always tell you hey, eat healthy food, and then you have a question: what's healthy food, healthy diet? And they will add on and say, further on, they say, more vegetable and fruits. Now we know healthy food, more vegetable and fruit. Then has there anyone, this is a mindset thing, has anyone told you that eat a healthy food, eat more meat? No, you never heard about that. When people say eat healthy food, healthy diet, more veggie and fruits, what does it mean? Because veggie and fruit are good for you, but you don't think about it. If you ask yourself, what is the unhealthy thing? Well, junk food is unhealthy food, refined food is unhealthy food, but no people will say, hey, healthy food, more meat, more animal products, or more animal proteins. No one ever said that, right? So avoid all the bad food, which means animal proteins, not good for you. Even in pregnancy, you worry about, what do you worry about? I don't know what you worry about when in pregnancy. Okay, B12, right? There's a supplement for it, okay? But in fact, the prenatal vitamins is something that you may consider to take, Hi, good morning, Veronica. Nice to have you here again today. So we're talking about miscarriage prevention. The last thing that we're going to talk is how to use moxibustion to prevent miscarriage. Okay, to prevent miscarriage. Okay, so you do want to remember these things. So what I mentioned, all this: no alcohol, avoid drunk, smoking, avoid infection. So wash your hands properly. Don't go for swimming, because going for swimming is probably, water, and it's not a good idea for you. And no, it's good. I can't. I'm late today because I had a haircut myself. So I took a bit longer this morning. Yeah. So yeah, look, I get a haircut today. I did it myself. Yeah. This is easier for me to manage. So I don't want to spend some time and do my hair in the morning. So just get a haircut. It's time for me to do that. Let's try to keep it short. And here, okay. Okay. Remember that having a miscarriage doesn't mean that you won't conceive again. So in the future, so most women who miscarry have healthy pregnancy later. Okay. Okay. Last thing that I'm gonna show you. Thank you. Very nice, isn't it? Yeah. I bought a machine last year. Cost about $60, and when I go for haircut, it costs about $15 to $20. So I've been giving myself haircut, about 5 or 6 times now. So that saves money too. But it's so easy. I learned the first time take longer, and now it's about 15 minutes, 10 minutes that I can finish all my haircut. Pretty cool. Yeah. And the first time my daughter helped me actually. Well, and the rest of it I managed it myself. So simple. It's so simple. Okay. Last thing that I'm going to show you today is how to use moxibustion. Okay. I don't know whether you know about moxibustion stick or not. I haven't got one in here, I think. But let's wait me for a minute. I may be able to find some moxibustion stick to show you. Okay. Okay. Give me a minute. May have it in here. This is my my toolbox. Look at that. All the needles in there. You know, all needles in here. I'm pretty sure I got some in here. I normally put in my car, but while the lockdown time, I bring it in. I haven't got back to my car yet. So in my toolbox, I have this. What do I need the light for? I need the light for moxibustion. So this is a moxibustion stick. This is a little one, you know. I don't have the other one. I may have it, I may not have it in here. Yep, no, I don't have it. Which is the one that I really want to show you is the what do you call it? Smokeless one. So if we light this one, it creates a lot of smoke. And I do have to tell you, mention it to you, when it creates a lot of smoke, it smells like marijuana. Okay. So because when I first practiced in New Zealand, I never had experience with marijuana. So when I first practice, and we practice in downstairs of a house. Okay, we moved house already, so that house my parents live in there. So in downstairs was a clinic. So we did that, and the neighbor came to us and said, "Well, do you guys do weed? You know, weed is marijuana in New Zealand." They say, "No, we don't do that. You know, we operate Chinese medicine clinic in here." They said, "Wow, we can smell it." I said, "Oh, okay." And then we realized it's actually moxibustion stick. Okay, moxa, yeah, and it smelled really like it. Okay, and when we did it in our clinic in the shop, you know, we have our clinics in the mall, and people walk around and they smell it and they come in. Do we? And they said, we don't do that. It's a moxibustion. It's a type of Chinese herbs, and it smells like it. Okay, it smells really like it. Okay, but it's not. Okay, let's say. So I usually do a black one, which is smokeless, much smokeless. So that one will do. The other one will do, but that one causes a lot of smoke, and I would suggest that you have to do it probably in the toilet or your shower, because you have what do you call it? Extract fan to take it out, or closer to the windows, and that the smoke will go out from the window. But if the wind blows to inside, it won't help by using this, you know, or you have to do it in the outside. But some point that you can do it in the outside, because some point that it's quite private and you don't want to do it in the outside. Okay, there you go. So you get a ginger. There's $2 coin. Okay, it's about that thick. Okay, about that thick. So you cut a piece of ginger, and you get a fork to make some hole on it. So from the front to the back, from the side, left side to the right side, make the hole and flip over. And again, so turn it over, front to the back, side, left side to the right side. Okay, when you finish this, put it on 220. Okay, 220. How do you get to 220? From your nose up there and to ear, the highest point of your ear. Do this. Fold your ear to the front, and that is the higher point on the ear. So go there, and this, here is 220. Okay, simple, right? So same over here. So when you get 220, put the ginger on top. So the reason you put ginger, because you may know that people talk about we moxibustion by hui 220, and they didn't ask you to do ginger. One of the greater things to do ginger for this point is because you can prevent that you burn it. It prevent that you, when you do the moxibustion, you burn the hair, right? People have a lot of hair, right? But like me, it's short. Okay, you don't want to burn the hair of the patient, right? And some patient here, quite a lot. You put ginger on top, it'll be like this, quite far distant from 220, right? So you press it down. You press the ginger down. So you press it down. So you light the moxibustion stick and do it on top of the ginger. So now I want to tell you that if you don't make any hold on the ginger, it takes long time, and when the ginger all burn, you probably haven't got any heat go through yet. So make some hole and use this on top and let the heat go through it to 220. So this is important. All right, I forgot myself. All right, so do it for how long? On this point, you can do it for 10 minutes or 5 minutes. Okay, 3 times daily. Right. So when you do it, just do clockwise like this. If the patient feel, oh, it's too hot now. When it's too hot, remove the stick and let go your hand. When you let go your hand, the hair will went back to how it was. So it will go like this, keep a distance. So the patient feel, oh, it's not that hot now. All right. So you ask them, are you feeling all right now? So how's the heat? Oh, nothing. So you push it down. The ginger contain the heat. Okay. The ginger still have the heat on it. Remain some heat in the ginger. So you push it down and the patient will feel the heat again. So how's it now? Oh, feel nice now. I can feel the heat again. That's good. Is it too hot? Not really. Okay, start to put it in here. So and keep a distance. Try to find the distance to patient just feel the heat, but not too hot. Constantly feel the heat. All right. And you want this constant heat there for 5 to 10 minutes. Okay. At least 5 minutes. 1 or 2 minutes doesn't help. Okay. Now, if the patient suffers from what? Early sign of miscarriage, spotting, bleeding, tummy pain, all right, and back pain, right? So they should, as soon as they have those signs, you can do those. They can do this, okay? Then definitely suggest your patient to get a blood test of HCG to see that the next day, do they HCG right up or not, okay? So it should double. If today you take the blood test is 3,000, the next day should be 6,000, right? And the third day should be 12,000. Okay, it double each time. Okay, this is how it goes. If it didn't double, it means the HCG is producing less, and that's not a good sign. Okay, but doesn't matter what symptom the patient have, and doesn't matter whether the HCG is low or high, doubled or not, or if the HCG has been doubled, but they have symptoms, bleeding, spotting, tummy pain, dragging down sensation, heavy sensation, lower back pain, then just go for it. Just do this point. This is the first point. There are a few more points later I'm going to show you. Okay. I want to tell you, if the patient have lower back pain and dragging down sensation, spotting, when you do this 5 to 10 minutes, especially for the pain, they can feel it, the pain way off. Some patients, they responded very well, the pain gone completely. Okay, that's one thing. But I do have to mention that not every patient have a well experienced subside of tummy pain or pain disappear. Okay, because I have patients, when I do this, disappear, the tummy pain disappears straight away, but some of them no, remain in there. Okay, so if then what are you going to do? The next point you're going to do is Guan Yuan. Guan Yuan, I don't know the English name. Guan Yuan is about 3 chun below belly button. Okay, now for you, if you're not an acupuncturist, you watch this video, now you may want to comment down there and Google and go to your acupuncturist. That's the best. Go to your acupuncturist, get them to show you and tell them about your conditions, and they give you acupuncture, and you buy moxibustion stick and do it. Ask them to show you the point that you can do it at home. Okay, they might not know about the ginger on here, and you have to put the hole in there. So not many people know about this, because in the textbook they always say, put ginger in here or just moxibustion 220, but they didn't tell you about making the hole on top. I figured out myself. Okay, next thing, over here, 血海 spleen. I don't know which point is spleen meridian, but it's called 血海. That is there's a triangle over here, right? Kneecap, and about 3 fingers above the kneecap over here. Okay, that's 2 points over here. So each point 5 minutes. 5 minutes. Then San Yin Jiao, which is spleen 6. All right. So in the inside of the ankle bone, 4 fingers above that, and right next to the bone, right next to the bone. There's a point called San Yin Jiao. So yes, for this point, and this point, you don't have to use ginger. Just directly on top for 5 minutes each. 5 minutes each. This is important. So I suggest my patient, if they come to me about miscarriage, I say, do it 3 times daily, and stop working. Just at home, do all the treatment, because you want to save baby. It's something that you can do at home, but of course I give them acupuncture and I talk to them about Chinese herbs. But to be honest, in New Zealand, because we talk about avoid drunk, right? And they're quite cautious about Chinese herbs. I said, oh, forget about Chinese herbs. Just do acupuncture and moxibustion. But in China, in Chinese culture, when you have, you see the sign of miscarriage, you start to take herbs. You don't do acupuncture because they quite afraid. They heard about a story, when you pregnant you can't do acupuncture. That's not true. Okay, but people worry about that. That's in Chinese culture. So, and here's opposite. I remember when I went back to Malaysia, it was 7 or 8 years ago, and my cousin, she's older than me, so she had a few miscarriage, and then while I was there, and she was pregnant, early pregnancy, and then she had tummy pain and dragging sensation and bleeding quite a lot, and off work, stay at home and lay on the bed. And I went there. I was on a holiday, so just two or 3 days, and stay in Malaysia and then go to China. And I went there and see her, and I prescribed herb for her, and she took the herbs. Then I show her how to do moxibustion stick. So quite lucky that I keep some of this in Malaysia home, in my house, in my parents' house in Malaysia. So I show her partner how to do this 3 times daily. Then I gave her acupuncture, 2 acupuncture before I left Malaysia. And the toddler now is going to school now to save a baby life, you know. So even though she had few miscarriage, then she had like she had few miscarriage, and she had all the signs like tummy pain, lower back pain, bleeding, and heavy sensation dragging down. And Chinese herbs, acupuncture, and moxibustion, we do it all. We do it all and save the baby and keep the baby well. Right. So remember, in the first trimesters, which is the first 12 weeks of your miscarriage, of your pregnancy, not miscarriage, is the highest chance of most people miscarriage in here, 10 to 15%, another 5% in within 20 months, which is 13 to 19 or 20, week 20. Okay, and they miscarriage. All right. So what happened in here is we, if the patient come to us for fertility treatment, so we always get them to stay acupuncture weekly when they're pregnant, weekly, or according if the condition is so bad for them, they're still very weak. A lot of conditions, symptom with pregnancy stage. So we ask them probably 2 acupuncture weekly until week 12. If they have miscarriage in the past, if the miscarriage is week 11 or week 13 or 14 or 15, in this different case, we want to treat them over 15 weeks, because if the last miscarriage is 15 week 15 miscarriage, we want to treat, help them prevent miscarriage over week 15, you know, bring up to 20. So weekly acupuncture, and after that just do monthly, once acupuncture 4 weeks. And then when it comes to week 36, 35, then what do? We suggest them to come with partner and ask them, what do you want? Because in New Zealand, are you going for giving birth labor in hospital or birth center or at home? So there's 3 different things. All right, hospital, birth center, home birth. Okay, which one are you going? So who will go with you? You know, who will be with you while label? So we suggest acupressure point. Whoever going with you, come in to learn the acupressure point to help you reduce the pain and shorten the labor time, and to help you give birth easily and faster, something like that, and much less pain. So it's natural way. You don't take herb, and we won't be in there with them. Otherwise, we can put needle, but we show them acupressure point, then guide them one by one and show them one by one, and they know how to take it and when. And we give them a note as well, and let them know how to use it properly. All right, this is for today. This is the prevention of miscarriage. So I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now, if you have any sign of miscarriage, go to your doctor first and get your HCG done. But I will tell you, doesn't matter what they test out the result. If the HCG doubled, that's great. If the HCG hasn't doubled, they have no solution. They won't give you any treatment. There's no treatment in Western medicines. And even though the HCG is high, it's good, but you're still bleeding, you have extreme pain, lower back and tummy, hey, acupuncture, Chinese herbs, and moxibustion are the greatest thing to help you. again, not 100%. I can't say 100%, but we have experience successful to help patient prevent miscarriage. All right. Thank you, Veronica. Thank you, Judith. Yep. So this is a good information. I hope you do get some out of it. Please help me to share this video and give me a thumbs up. And I'll see you tomorrow. And I love you all. Stay awesome. Bye-bye. Everyone, welcome to Szenan-Balance Live. I'm Szenan-Balance.